So today we're in a cosmetic consultation at Face Plus with Chantel. She's a 60-something Mauritian lady who has some concerns about her face. We already know her past medical history is unremarkable and that she's had no cosmetic treatment in the past. We always begin by asking our patient what concerns them the most. Chantel, what bothers you about your face?
Really the lines behind between the eyebrows, around the mouth, and the sagging on the cheeks.
I see. I always begin with skin. When we look at Chantel's skin, it looks great for a 60-something lady. However, she does have some signs of solar damage, and this is shown with irregularities and hyperpigmentation. Treatment of this begins most simply with a good skincare regime and some laser treatments for this lady. 2 laser treatments would be used: laser genesis to tighten and regenerate collagen in her subdermis, and IPL or limelight laser to get rid of this hyperpigmentation. Now we turn our attention to the lines that she doesn't like. She told us that the lines of concern were these lines around her mouth, in between and around her eyes. In days gone by, we would have first treated these areas, but that is not the right thing to do. What we know now is the face doesn't drop with age, it loses volume. And the key to getting a natural anti-aging appearance is replacing this lost volume. I would replace it through her cheek, in her pre-temple area, in front of her ear. Replacing this volume to where it was before would give her a lovely subtle lift, and you can see the change that occurs around her mouth. What this does is treat these problems up here. I don't use muscle relaxant nearly as much as I used to in the past, but it's still a useful tool in some cases, especially for these glabellar lines here and here. This injectable regime would take about 1 hour. It's sometimes called the lunchtime facelift. It's simple and easy, and the results are excellent. Take about a week to kick in. You must think of your skincare and anti-aging care as a long-term proposition. You can't just walk in and out and expect a result straight away. And at Face Plus, that's what we offer: a bespoke, tailored treatment made for you and your facial needs. We return here today with Chantal 6 weeks after we first met. Back then, she told us about different problem areas she had with her face. And we've treated her, or begun her treatment, with our layer cake technique. That's multiple different disciplines to give her a natural, fantastic result. So what we've done is concentrate on replacing lost volume. We've done this with some hyaluronic acid fillers. We've replaced lost volume in her temple regions, pre-auricular regions, a small amount in her mid-face as well. This has served to elevate and lift her mid-face. It's also reduced her jowl significantly. Once this was done, we also used a small amount of filler in her marionettes, the lines down from the corner of her mouth, and her nasolabial folds. At the same time, we've used a small amount of muscle relaxant in her glabella, frown lines, forehead, and crow's feet. The key with injectables is less is more. A little bit of filler here and there, a little bit of muscle relaxant as well. They work together. What we're aiming for in this lady and all our patients is a natural result. We want her to look great for her age, not ridiculous for her age. We've complemented this treatment with our Dr. Spiller treatment technique. These products rehydrate, rejuvenate, and stimulate collagen. The multiple layers of treatment are what give the best and most natural result, and you can see it in this lady here. And we haven't finished. Where do we go from here? Next step for her will be Tighten Laser. Our Tighten Laser really will give a much smoother contour to her neck skin. Your anti-aging is an ongoing process, something that you need to slowly and carefully maintain as years go by. With a layer cake technique using multiple disciplines with a careful team, you can be assured of good results.